You have probably never once looked at the pill you take every night for sleep or allergies and thought, could this be affecting my memory? Most people have not. And that is exactly why what I am about to share matters so much. Because here is the truth that most people over 60 are never told. Researchers at the University of Washington tracked more than 3,000 adults for 7 years and found that regular use of certain common medications increased dementia risk by as much as 54%. These are not obscure drugs buried in a specialty pharmacy. Several of them are sold over the counter. Some of them may be sitting in your medicine cabinet right now. And most of the people taking them have absolutely no idea what the research says about what they are doing to the aging brain. I am Dr. Linda Thompson, and on this channel I bring you clear, evidence-based health guidance designed specifically for adults over 60. Today I am walking you through 7 medications that studies link to memory loss and cognitive decline in older adults. I will explain exactly what each one does inside the aging brain, and I will give you a specific, practical plan you can bring to your very next doctor's appointment. Many of the people I have worked with described a gradual fogginess that had crept up on them so slowly they had stopped noticing it. They assumed it was age. Some of it was not. And when the right medication changes were made under careful medical supervision, several of them described feeling sharper than they had in years. Stay with me through all 7. Because the action plan at the end of this video could genuinely change something important for you or for someone you love. Let us start with the first medication, and this one surprises almost everyone who hears it. The first medication is diphenhydramine. You probably recognize it by its brand names: Benadryl, Zizquil, Tylenol PM, Advil PM. Millions of older adults reach for one of these every night as a sleep aid. Millions more take it regularly during allergy season without a second thought. It feels harmless. It is sold without a prescription. It has been around for decades, but diphenhydramine belongs to a drug class called anticholinergics. And what anticholinergics do to the aging brain is something every older adult deserves to understand clearly. Acetylcholine is the primary chemical your brain uses to form and retrieve memories. Anticholinergic drugs block that chemical. Research published in JAMA Internal Medicine found that cumulative anticholinergic use was directly linked to a significantly increased risk of developing dementia, and the researchers were not describing decades of heavy use. They saw measurable effects from doses taken over just a few months. Here is what makes this particularly serious for adults over 60. The aging brain naturally produces less acetylcholine than it did at 40. When you add a drug that blocks what little remains, the cognitive impact is dramatically amplified compared to what that same drug would do in a younger person. What causes mild drowsiness in a 35-year-old causes genuine memory impairment in someone your age. This is precisely why the American Geriatric Society placed diphenhydramine on their official Beers criteria, the list of medications considered potentially inappropriate for older adults. If this is in your medicine cabinet, safer alternatives exist. And we will come back to that in the action plan. But here is what most people never realize about the second medication on this list. The second medication is benzodiazepines, Xanax, Ativan, Valium, Klonopin, prescribed for anxiety, panic, and insomnia. They calm the nervous system effectively for short-term situations, but for daily long-term use, the picture changes considerably. A landmark study published in the British Medical Journal followed over 9,000 participants and found that regular benzodiazepine users faced a 66% increased risk of developing Alzheimer's disease. The researchers controlled for anxiety as a variable. The risk came from the medication itself, not the underlying condition it was treating. Many of the people I have worked with came to me after years on a benzodiazepine prescribed during a difficult period in their lives. A loss, a health crisis, a period of severe insomnia. The original prescription made sense at the time, but years later, nobody had revisited it, and the cognitive effects had been building so gradually that they had been attributed entirely to aging. One patient, a 71-year-old woman who had been on a low-dose benzodiazepine for 3 years following the loss of her husband, began repeating stories within the same conversation. By year 3, she could not reliably remember appointments she had written down herself. When a careful supervised taper was completed over 6 months with appropriate non-medication support, her recall improved noticeably within 8 months of stopping. Her family described the change as meaningful. That pattern, in my experience, is not rare. Have you or someone in your family been taking a benzodiazepine for more than a few months? Drop a comment below. I read every single response, and knowing what people are navigating shapes what I cover on this channel. The third medication is zolpidem, sold as Ambien, one of the most prescribed sleep drugs in the world and one of the most concerning for older adults specifically. Zolpidem works on the same brain receptors as benzodiazepines, suppressing the central nervous system to force sleep. But research from the National Institutes of Health shows that it disrupts slow-wave sleep, the deep restorative phase where your brain literally clears out toxic proteins associated with Alzheimer's disease. You fall asleep faster. But the quality of that sleep undermines your brain's overnight cleaning cycle. Long-term users show measurable reductions in memory consolidation and processing speed. The FDA has issued multiple warnings specifically about zolpidem in adults over 65, recommending lower doses and strict limits on duration of use. Here is what I want you to understand about the fourth medication, because this one surprises nearly everyone who hears it, including people who have been taking it for years. The fourth medication is oxybutynin, commonly prescribed for overactive bladder and urinary incontinence. These are conditions affecting a very large percentage of adults over 60. And because those conditions are genuinely disruptive and distressing, the prescription feels entirely justified. The bladder problem is real. The medication addresses it, but oxybutynin is one of the most potent anticholinergics in common clinical use. It crosses into the brain easily and aggressively blocks the same memory-forming pathways we discussed with diphenhydramine. Brain imaging studies have shown measurable reductions in metabolic activity in patients taking oxybutynin regularly. If you have this prescription, a medication called mirabegron addresses the same bladder condition through a completely different mechanism and does not carry the same cognitive risk profile. That conversation with your prescribing physician is worth initiating soon. Now, the fifth medication is one that involves a great deal of nuance, and I want to be very careful about how I explain it. The fifth medication is statins, atorvastatin, simvastatin, rosuvastatin, prescribed to tens of millions of older adults to manage cholesterol. These medications offer clear cardiovascular benefits for many patients, and those benefits are well established in the research. I am not suggesting anyone stop a statin based on this video, but a significant subset of users, and studies suggest it may be as many as 1 in 5, experience what the FDA now officially recognizes as cognitive side effects, including confusion and memory loss. The proposed mechanism involves the brain's own cholesterol supply, which is entirely separate from cardiovascular cholesterol and plays a critical role in maintaining nerve connections and synaptic function. If you have noticed cognitive changes since starting a cholesterol medication, that connection deserves investigation, not an immediate decision to stop, but a direct, specific conversation with your physician about whether what you are experiencing might be related, and whether your individual risk-benefit profile warrants a review. The sixth medication is tricyclic antidepressants. Amitriptyline and nortriptyline are prescribed not just for depression, but also for nerve pain, chronic migraines, and sleep disturbances in older adults. These drugs carry an extremely high anticholinergic burden, among the highest of any medication in common clinical use. Newer antidepressants in the SSRI and SNRI families carry far lower cognitive risk and are generally considered more appropriate for older adults for this reason. If you are currently on a tricyclic for any condition and you are over 60, ask your prescribing physician directly whether a safer alternative could address your situation equally well. That is not a confrontational question. It is an informed one, and the right physician will welcome it. Here is something most people are completely unaware of, and it ties all of this together in a way that I think is important to understand before we reach the final medication. Scientists at Indiana University School of Medicine developed something called the Anticholinergic Cognitive Burden Scale. They assigned numerical risk scores to hundreds of common medications and found that seniors with a high cumulative burden, meaning they were taking multiple medications that each carry some degree of anticholinergic activity, showed significant brain atrophy on MRI scans compared to those with low scores. Few people know this. Many older adults are simultaneously taking 3, 4, or 5 drugs that each carry some anticholinergic activity. No single pill looks alarming in isolation. But the total combined burden is quietly and steadily affecting memory and cognition in ways that no individual prescription review would reveal. This is why a comprehensive medication review that considers your full list together, not each drug separately, is so important. And the seventh medication is one that has an excellent overall safety reputation, which is precisely why the hidden danger so often goes undetected. The seventh medication is metformin, the most commonly prescribed type 2 diabetes medication in the world. Metformin itself does not have anticholinergic properties, but long-term use depletes vitamin B12, and that depletion is the hidden danger. A study published in the Journal of Clinical Endocrinology found that nearly 30% of long-term metformin users develop a clinically significant B12 deficiency, and B12 deficiency causes memory problems, mental fog, and cognitive decline that is frequently mistaken for early dementia. Not because the person is developing dementia, but because nobody tested for B12 in the context of their metformin use. Many of the people I have worked with who were on long-term metformin had never had their B12 levels checked specifically in relation to that medication. When deficiency was identified and addressed under physician supervision, the cognitive improvements some of them experienced were meaningful enough that they described it as clarity returning after a long absence. The connection between metformin and B12 is well documented, and it is well within your rights to ask your physician to check your level at your next visit. So here is your action plan. Specific, clear, and immediately applicable. Start by writing down every prescription and over-the-counter medication you currently take. Include sleep aids, allergy pills, anything with PM in the name, and any supplements you take regularly. Everything. Next, bring that complete list to your next appointment and ask your physician specifically to review your total anticholinergic burden as a combined picture, not just each medication individually. Ask whether any high-burden medications have safer alternatives that would address your condition equally well. If you take metformin, ask for a B12 blood level test at your next visit. If your level is low, ask about supplementation. Research suggests the methylcobalamin form is particularly well absorbed by older adults, and that distinction matters. If you currently take a benzodiazepine or zolpidem on a regular schedule, please do not stop abruptly. Stopping these medications without a medically supervised taper can trigger serious withdrawal effects that are dangerous. Work with your physician to reduce the dose gradually over weeks or months with appropriate monitoring and support. And if you have noticed cognitive changes, memory lapses, mental fog, slower processing that have developed gradually over months or years, bring that observation directly into the conversation. Describe when it started, describe what it feels like, and ask your physician whether any medication on your current list could be contributing. Here is what I want to leave you with. Many cases of what feels like age-related memory decline are actually medication-related cognitive effects, and that distinction matters enormously. Because medication-related cognitive effects can often be stopped, sometimes partially reversed. Research consistently shows that when these medications are reduced, replaced, or supplemented appropriately under physician guidance, many older adults experience meaningful improvements in memory, processing speed, and mental clarity within months. Your brain has carried you through an entire lifetime of experience. It deserves a medication list that protects it rather than quietly erodes it. And you now have enough information to start that conversation. Drop a comment below and tell me which of these 7 medications surprised you most. Or tell me if you are planning to review your list after watching this. I read every single comment, and your response helps me understand what to cover next. If this gave you something useful today, please share it with someone you care about who is over 60. One conversation with the right information genuinely changes what someone does at their next appointment. Subscribe if you have not already, because next week I am covering the 5 nutrient deficiencies that studies indicate are shockingly common in adults over 60 and directly linked to accelerated cognitive decline. It is one of the most practical and immediately applicable videos I have put together for this channel, and I do not want you to miss it. Take good care of yourselves. I will see you next week.